According to OSHA, approximately 5.6 million workers in healthcare and other facilities are at risk of exposure to bloodborne pathogens such as HIV, hepatitis B, and hepatitis C. Employers are required to adhere to all OSHA standards and provide training to employees that could be exposed to bloodborne pathogens. Employees are required to take the bloodborne pathogen training and follow all procedures related to the handling of potentially infectious materials. OSHA's bloodborne pathogen standard prescribes safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. All employees who may face contact with blood and other potentially infectious materials while performing the duties of their job are covered by the bloodborne pathogens standard. Good Samaritan acts, such as assisting a coworker with a nosebleed, would not be considered occupational exposure. Exposure can occur as the result of a needle stick, a cut from a sharp object, or contact of mucous membranes, for example, the eye, nose, mouth, or broken skin with contaminated blood. Treat all human blood and body fluids as if they are infectious. Here are some examples of bloodborne pathogens that you should be familiar with. Hepatitis B is a disease that attacks the liver. The disease can be prevented by a hepatitis B vaccine. Symptoms include fatigue, stomach pain, nausea, loss of appetite, jaundice, and darkened urine, though sometimes the disease doesn't present any symptoms. Hepatitis C is also a disease that attacks the liver. However, the disease cannot be prevented by vaccine. Signs and symptoms of the disease include fatigue, weight loss, nausea, and depression. The majority of people don't have any symptoms. HIV is the virus that causes AIDS. When a person has HIV, it means that the HIV virus is in his or her body. Over 1 million people are living with HIV in the United States. When a person has AIDS, it means HIV has made it so the body cannot fight off infections. Since AIDS is an advanced form of an HIV infection, everyone who has AIDS also has HIV. Symptoms can include fever, chills, rash, night sweats, muscle aches, fatigue, and swollen lymph nodes. If you are exposed to potentially infectious materials, wash the exposed area with soap and water. Splash your nose, mouth, or skin with water. Irrigate your eyes with water or saline. Report the exposure to a supervisor. If another worker comes into contact with infectious materials, direct the worker to a healthcare professional immediately. Specialized clothing or equipment worn by an employee for protection against infectious materials must be properly cleaned, laundered, repaired, and disposed of at no cost to employees. Handle contaminated laundry as little as possible and use personal protective equipment. Laundry must be bagged or containerized at location where used, and must be placed and transported in labeled or color-coded containers. Contaminated work surfaces must be decontaminated with an appropriate disinfectant. Biohazard warning labels are required on containers of regulated waste, refrigerators and freezers containing blood and other potentially infectious materials, and other containers used to store, transport, or ship blood or other potentially infectious materials. In summary, OSHA's bloodborne pathogen standard prescribes safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Implementation of this standard will help prevent hepatitis B cases and significantly reduce the risk of workers contracting AIDS, hepatitis C, or other bloodborne diseases.
Hello, my name is Jill.
And I'm Casey Davis.
Today we will discuss the 8 various topics of HIPAA. First, we will answer the question, what is HIPAA? HIPAA is the acronym referring to the Health Insurance Portability and Accountability Act, which was enacted in 1996. HIPAA is designed to improve efficiency and effectiveness of the healthcare system. The Department of Health and Human Services, Office of Civil Rights administer and enforces the law.
There are 5 main purposes of HIPAA: to provide continuity and portability, to combat fraud and abuse, to provide uniform standards, to reduce administrative expenses, and to ensure security and privacy. Now we will take a look at a quick overview of HIPAA.
In 1996, the U.S. Congress enacted HIPAA, or the Health Insurance Portability and Accountability Act. This act governs the use, transfer, and disclosure of health-related information. One of the requirements of HIPAA is the protection of protected health information, known as PHI. PHI is defined as any piece of individually identifiable health information, such as a person's medical records or healthcare payments. The protection requirement applies to organizations like ours that store, process, or transfer patient information in electronic, paper, or oral form. The HIPAA regulations have been amended and updated many times. The most significant update happened on February 17, 2009, when President Barack Obama signed the American Recovery and Reinvestment Act of 2009 into law. This included the Health Information Technology for Economic and Clinical Health Act, also known as the HITECH Act. The HITECH Act is the same law that created the Electronic Health Records Incentive Program, as well as the HIPAA Breach Notification Rule. The Breach Notification Rule requires that covered entities and business associates must provide notification of a breach to affected individuals, the Secretary of the U.S. Department of Health and Human Services, and, in certain circumstances, the media. Safeguarding PHI is an important regulatory requirement for organizations like ours. In the video Data Security, you learned steps for protecting sensitive information. The same steps apply to protecting PHI. However, there are some additional steps that apply when you handle PHI. Only share patient data with authorized personnel who have a need to know. You must obtain the individual's written authorization for any use or disclosure of PHI that is not for direct care or treatment. A central aspect of HIPAA is the principle of minimum necessary use and disclosure. You must make reasonable efforts to use, disclose, and request only the minimum amount of PHI needed to accomplish the intended purpose of the use, disclosure, or request. It is important that our organization remains compliant with industry and regulatory standards. By respecting these guidelines, you help ensure that our organization protects PHI and we remain compliant with industry and regulatory standards.
On any given day, about 1 in 25 hospital patients have an infection caused by their medical care. Almost half of these patients are 65 or older. There are 5 places where patients are most likely to get infections: in the bloodstream, the urinary tract, the gut, and the 2 most common places are the site of surgery and the lungs. The germs most likely to cause healthcare-associated infections include C. difficile or deadly diarrhea, staph, including the drug-resistant type known as MRSA, a family of germs known as Enterobacteriaceae that includes CRE, the nightmare bacteria, Enterococcus, which can be resistant to an important antibiotic, vancomycin, and Pseudomonas, which can cause infections of the lungs and bloodstream. 1 in every 9 patients who gets an infection will die during their hospitalization. Over the last several years, great progress has been made in preventing some infections. For example, bloodstream infections in patients with central lines have been nearly cut in half in the last 5 years. But more work needs to be done. CDC's goal is to eliminate all healthcare-associated infections. We work 24/7 to save lives and protect people.
To begin, it is important to understand that the complaint handling and reporting process is a component of the overall quality system. One of the key components to a successfully implemented complaint handling process is to understand and to cover process interdependencies. Product safety assurance is a continuous cycle that's made up of development, surveillance, correction and improvement, and monitoring, resulting in a higher level of product quality with each iteration of the cycle. These interdependencies can be illustrated by the product safety assurance model that we'll now see in detail. When we look at a product safety assurance cycle, the heart of the quality system is management controls. As with any quality system, there has to be a top-down commitment to quality and regulatory compliance. From executive management down to the individual contributor, all employees must embrace quality as a key part of their job. Additionally, it is necessary to have senior and executive management involved in monitoring every aspect of the quality system to provide oversight and to ensure regulatory requirements are met. Risk management is another component of the product safety assurance cycle that is central to the quality system. Risk plays a role in all other components, including being a critical factor in determining which complaints are reportable. Continuing on, as a result of surveillance activities based on evaluating identified issues, investigations may be required to reach resolution. As a result of evaluation, and this includes data analysis and investigations, corrections, corrective actions, and preventive actions may be required and directly link back to further product and process improvements. Along the entire product safety assurance cycle, training and document and records control support the other cycle components. Good training and documentation practices are essential to compliance and to enable one to show and to prove that the quality system is compliant to the applicable regulations and the regulatory agencies.
Tuberculosis, also known as TB, is spread through the air from one person to another. When someone with pulmonary TB disease coughs, TB bacteria are expelled into the air in tiny water droplets. These droplets can remain floating in the air for several hours, making it possible for someone nearby to inhale them. Once a person has breathed in droplets that contain TB bacteria, they travel down the trachea and enter the lungs, where they collect in the alveolar sacs. Once in the alveolar sacs, the bacteria begin to multiply. The body's immune system starts working and macrophages begin to surround the bacteria. A granuloma is formed to keep the bacteria from spreading. The TB bacteria remain in the lungs, but the body is protected from disease by the granuloma. In 8 to 10 weeks, the person will most likely test positive for latent TB infection. The progression from latent TB infection to TB disease occurs when the granuloma break open and the TB bacteria multiply. Then the person becomes sick with TB disease and may be infectious. This progression can occur immediately after infection, many years later, or not at all. When the TB escapes from the granuloma and begins destroying a person's lungs, it's called pulmonary TB. TB bacteria can also enter the bloodstream and travel to other parts of the body, causing extrapulmonary TB.